Introduce self and verify the client's identity. While using cane, hold the cane with the hand on the stronger side of the body to provide maximum support and appropriate body alignment when walking. Position the tip of a standard cane about 6 inches to the side and 6 inches in front of the near foot so that the elbow is slightly flexed. When maximum support is required, move the cane forward about 30 centimeters or a distance that is comfortable while the body weight is borne by both legs. Then move the affected weak leg forward to the cane while the weight is borne by the cane and stronger leg. Next, move the unaffected stronger leg forward ahead of the cane and weak leg while the weight is borne by the cane and weak leg. Repeat the steps. This pattern moving provides at least 2 points of support on the floor at all times. Inspect the crutch tips regularly and replace them if worn. Keep the crutch tips dry and clean to maintain their surface friction. If the tips become wet, dry them well before use. Wear a shoe with a low heel that grips the floor. Rubber soles decrease the chance of slipping. Adjust shoelace so they cannot come untied or reach the floor where they might catch on the crutches. Consider shoes with alternative forms of closure, for example, Velcro. Especially if you cannot easily bend to tie laces. Slip-on shoes are acceptable only if they are snug and the heels does not come loose when the foot is bent. When using walkers, when maximum support is required, move the walker ahead about 15 centimeters or 6 inches while your body weight is borne by both legs. Then move the right foot up to the walker while your body weight is borne by the left leg and both arms. Next, move the left foot up to the right foot while your body weight is borne by the right leg and both arms. If one leg is weaker than the other, move the walker and the weak leg ahead together about 15 centimeters or 6 inches while your weight is borne by the stronger leg. Then, move the stronger leg ahead while your weight is borne by the affected leg and both arms. Prepare the client for ambulation. Ensure the client's safety while assisting the client to ambulate, and protect the client who begins to fall while ambulating. When assisting a client to ambulate, when it comes to children, teach the child the importance of appropriate activity and the use of assistive devices if necessary. Help the children focus on what they can do rather than what they cannot. Came to older adults, inquire how the client has ambulated previously and check any available charts, notes regarding the client's ability and modify assistance accordingly. If assistive devices such as a walker or cane are used, make sure clients are supervised in the beginning to learn the proper method of using them. Crutches may be more difficult for older adults to use due to decreased upper body strength. Be alert to signs of activity intolerance, especially in older adults with cardiac and lung problems. Set small goals and increase slowly to build endurance, strength, and flexibility. Be aware of any fall risks the older adults may have, such as the following: effects of medication, neurologic disorder, orthopedic problems, presence of equipment that must accompany the client when ambulating, environmental hazards, orthostatic hypotension. In older adults, the body's responses return to normal more slowly.
Before transferring a client, assess the following: the client's body size and weight, ability to follow instructions, activity tolerance, level of comfort, the space in which the transfer is maneuvered, the number of assistants needed to accomplish the transfer safely. Then provide for client privacy. Next, transfer the client securely to the stretcher. If the client can transfer independently, encourage him or her to do so and stand by for safety.
Nang kain po ba? And your and the line you still. And then
Ensure client comfort and safety. Make the client comfortable, unlock the stretcher wheels, and then move the stretcher away from the bed. Also, immediately raise the stretcher side rails or fasten the safety straps across the clients. Before transferring a client between bed and chair, assess the following. Prepare and assess the client. Assist the client to a sitting position on the side of the bed. Next, place a gate or transfer belt snugly around the client's waist. Check to be certain that the belt is securely fastened. Then give explicit instructions to the client. Next, position yourself correctly. And then, assist the client to stand and then move together toward the wheelchair or sitting area to which you wish to transfer the client. Lastly, assist the client to sit and ensure the client's safety.
Hello everyone, today we will demonstrating for essential patient positioning. Prone, supine, lateral, and Sims position. Proper positioning is crucial in healthcare to ensure patient comfort, prevent complications, and assist your various medical procedures. Let's begin. Prone position. The prone position is when the patient lies on their stomach, face down. This is useful for certain surgical procedures, respiratory treatments, and relieving pressure on the back. Step 1. Assist the patient into turning onto their stomach. Step 2. Ensure the head is turned on one side for breathing. Step 3. Position arms comfortably at the sides or under the head. Step 4. Place a pillow under the lower abdomen to reduce lower back stress. Uses: improving oxygenation in respiratory condition, post-surgical procedure on the back, relieving pressure sores in patients lying supine for long periods. Supine position. A supine position is when the patient lies flat on their back with their arm at their side. This is the most natural resting position and is used for examination, surgeries, and procedures involving the anterior body. First step, ensure the bed is flat and level. Step 2, have the patient lies on their back with their head extended and arm at their side. Step 3, place a pillow under the head for comfort. Step 4, if needed, add a small pillow under the knee to relieve lower back strain. Uses: post-surgical recovery, physical assessment, patient rest. Lateral position. The lateral position involves the patients lying on their side with their legs slightly bent. This is useful for reducing pressure under certain areas and aiding in patient comfort. Step 1. Assist the clients in rolling on their side. Step 2. Keep the lower arm slightly forward and the upper arm resting in front of the body. Step 3. Place a pillow under the head and between knees to maintain spinal alignment. Step 4. Ensure the shoulders and hips are aligned to prevent strain. Uses: preventing pressure ulcer, sleeping position for patients with certain medical condition, facilitating drainage in patients with respiratory condition. Sims position. Sims position is a variation of lateral position where the patient is semi-prone with one leg flexed. This position is used for rectal examination, enemas, and procedures requiring access to the perineal area. Step 1. Begin with the patient in the lateral position. Step 2. Adjust the lower arm behind the patient and position the upper arm flexed in front. Step 3. Flex the upper leg while keeping the lower leg slightly bent. Step 4. Place a pillow under the head and between the legs for comfort. Use rectal exams and enemas, reducing pressure on sacral areas. Post-surgical recovery for certain procedure.